All right, about a month ago on BT, you probably remember we had a nurse practitioner from Newfoundland and Labrador, part of a team deployed to Ontario's hospitals. She joined us ahead of her first day on the job. So here's a refresher. Jennifer Hanks, thank you so much. Come on, it doesn't get any better than that, Jennifer. Thank you so much. Take care of yourself, to you and your team. You heard the cowbell, you heard Dina, you heard Sid. Everyone was so proud of her. Jennifer Hanks got a huge round of applause. Fast forward to today, she is now back home out east, self-isolating, as our province's hospital and ICU numbers are slowly starting to drop. We're still seeing some concern, but they're starting to drop. So what was it like on the front lines? We say good morning to Jennifer Hanks yet again. Good morning.
Good morning, Mel. Thanks for having me back.
Thank you so much for joining. And as soon as we wrapped up the interview last month, we said, we've got to get you back, check in with you, see how you're doing. You had initially a 3-week stay in Toronto. You extended it by a week. Why did you want to do that?
You know, if I could have extended it longer, Mel, I honestly would have stayed longer. Once I integrated into the team and my team integrated into the team, it was such a profound work experience, and we really felt welcomed, and we really felt like we were making an impact and a difference. And you know, I've said it before and I'll say it again, we feel a little guilty going home. There's actually one of our nurses from our team is still there. She stayed an additional week after me. It was hard to come home, and our presence in the unit was certainly noticed, and you know, they've reached out to us already and said, you know, we miss having you here. So it was just such a wonderful experience.
Jennifer, we're going to keep on rolling these pictures because it's incredible that the team of about 19 coming from Newfoundland and Labrador helping out. And as you mentioned, one person is still here with us. What was the experience like for you? You were based at Toronto General.
Yes, so we worked at the Toronto General Hospital Medical Surgical ICU amongst their interdisciplinary team there. It was a heartbreaking experience. Those nurses and the team members, the whole team, they've been working so hard for the past, 14 to 16 months. It was a rewarding experience to be able to go in and give the nurses some reprieve and, help with their staffing ratios while we were there, and to care for these patients and get to know their families. It was a very informative experience. You know, in Newfoundland and Labrador, we haven't experienced the volume of patients that they've had in Toronto. So we were able to learn a lot about the care of, critically ill COVID patients that can be reciprocated and taken back to our own province. It was an experience that I'm never going to forget. I definitely left a piece of my heart in Toronto, and I look forward to the connections that maintaining the connections that I've made with the staff on this unit.
Jennifer, how fitting that you were here for National Nursing Week, and we had a nursing panel as well. But we kept on using the word that we are celebrating nurses, and a lot of the messaging coming back to us was that this is not a time to celebrate, and that we, or the nurses, were just having a really tough time with mental health and balancing schedule, and seeing, as you said, it's not just about the patient, it's their families. With nurses on the front line, that you do so much. So what was that like for you mental health-wise as you saw what was happening here, but also did it take a personal toll on you?
It's really great you mentioned that, Mel, actually, because I thought about that a lot when I was up there during Nurses Week. It was probably the most challenging Nurses Week I've ever endured. Nurses are known for their collegial relationships and their teamwork, and this year it wasn't a time of celebration. There was no time to celebrate. It was still, going to work, trying to get through the day, taking on the hardships of the patients that you were caring for. It was really challenging. It certainly didn't have the same tone as all the other Nurses Weeks that I've been a part of. That being said, we did our best to celebrate each other and our triumphs and stick together as a team. From a mental health perspective, we've been, the Newfoundland and Labrador team has been really fortunate to have a mental health team assigned to us from our province to help support us throughout this. But I think the profound mental health impacts that will be had on healthcare professionals in Ontario and other provinces that are very hard hit are are going to be dramatic, and I think that we don't realize those effects yet. But these healthcare workers have certainly experienced a lot in this past year, and they're very vocal about it. They're very honest about what they're feeling and what they're seeing. And I think back to our first interview when we nurses, you called me a hero, and we were calling nurses heroes. What I saw in that team in Toronto is beyond the definition of a hero. Those nurses go into work every day and they adapt and they take on new roles. And I think that I'll be celebrating their leadership for a long time.
Jennifer Hinks, we thank you for joining us. And listen, when this is done, we invite you back to the studio. Would love to see you back here in Toronto as your second home.
I would love to come back. Thank you so much.
Thank you. All right, that's Jennifer Hinks back in Newfoundland and Labrador. She was just here in Toronto. An incredible story here, and still so much more work that needs to be done. All right, Steph, we're going upstairs to you.